Hi, I'm Dr. Goel. I'm a general neurologist. Today's video is about meningiomas. So a meningioma is a tumor of the meninges. Meninges are protective layerings over the brain and the spinal cord. So just to give you a visual example, let's say this is a toy brain and we have this skull on top. I'm using a bowl here. And the meninges are essentially paper thin layers on top of the brain, and they wrap around the entire brain and they go down onto the spinal cord as well. So when there's a meningioma, it can, depending on where it is, it can sometimes push on the surrounding brain or spinal cord, but majority of the times they are asymptomatic. They do not cause any symptoms. They are very slow growing typically, and most of them are non-cancerous, which means they do not spread. I often admit to my patients that I may have a meningioma. I do not know because I've not had imaging of my head or my spinal cord. I may not know because even if it's there, it's likely asymptom. It's not causing any symptoms. In cases where the meningioma is faster growing or is in a location where it's compressing on the surrounding brain tissue or cord and causing symptoms, then surgical intervention may be needed or radiotherapy might be needed to address that meningioma. And at that time, the risk of intervention versus the risk of leaving the meningioma would have to be analyzed and discussed. As I said, a lot of them are asymptomatic and they do not need any intervention. I hope that answered your questions about meningioma, and I will see you in my next video.